The second issue we're having a battle over is spending. The new administration thought we were spending too little as a country, and they did an extraordinary thing. In the middle of the fiscal year, they asked for and received an 8% increase in discretionary domestic non-security spending in the middle of the fiscal year. In the middle of the year, 8% increase. Went from $393 billion to an annualized basis of $410, but they spent the $17 billion in 6 months. They then turned around and asked for a new budget for the coming year that increased discretionary domestic spending on top of that 8% new higher baseline, another 12%. So by October 1 of last year, the federal budget for discretionary domestic spending had grown by 25% in 10 months. $100 billion plus in less than 10 months more federal spending. That means over the next decade, we will spend over $1 trillion more than the government was expected to spend as of January 19th, 2009, the day before President Obama came into office. And that doesn't include the stimulus. The stimulus is $814 billion, with the interest that we owe on that money since we borrowed every nickel of it, is another $1 trillion plus. So $2 trillion more in federal spending over the next decade, all passed within the first 10 months of the Obama administration. This, of course, has led to a disagreement about the size of the federal government. There has been a remarkable consensus since World War II that the size of the federal government ought to be roughly somewhere between 18 to 21% of the GDP, floating around 20% of GDP. A remarkable consensus, Republicans and Democrats alike. And yet today, the federal government is taking up 25% of the GDP. It's taking up a quarter larger a share of the American economy than it did before this president came into office. And there's a big disagreement as to whether or not the government should become that large that quickly. This comes to the issue then of the deficits. President Obama laid out a budget resolution in February of 2009 that was his economic blueprint, his budgetary blueprint for the next 10 years. This is an act required by the Budget Act of 1974. Every president has to lay out a budget framework, and the Congress must pass the budget framework in order to give protection for the consideration of the appropriations bills. Since 1974, this has been the law of the land, and President Obama submitted his blueprint. And guess what? Gone was that concern about those deficits of Bush that were 2.1% of GDP. Instead, he called for spending that would average deficits of over 5% of GDP for the next 10 years. And what does that mean? That means we would double the size of the national debt in 8 years, or it should be 5 years, and nearly triple it in 10. In fact, President Obama will run up more debt in the first 20 months and 11 days he's in office than Bush ran up in 8 years. And the only difference is when Bush was running up those deficits, the economy was growing in size from $9.2 trillion in size to $14.5 trillion in size. And as a result, the GDP stayed in the 30s as a percentage of the public debt held by the public debt of the United States ran about 30% of GDP. Now it's on its way to nearly 80. That quick. It is reaching an unsustainable level. And it wasn't an accident. It's a plan. It's his blueprint. It's not a warning. It's his plan. In fact, it was such a bad vote for Democrats to take. Did you know this? This year, for the first time since 1974, the House of Representatives failed to take up and failed to pass a budget resolution. The first time since 1974. And why? Because members didn't want to go home with a fresh vote on their record that said, I'm in favor of blowing up the deficit and I'm in favor of blowing up the size of government. And so they failed to meet their legal obligation under the law. Then we get to health care. Why did we do it? The president said we got 46 million uninsured Americans. And that ought to scare us. 46 million people ostensibly without medical coverage ought to worry every single American. Except that the number's not that simple. It's not that easy. Go to the Census Bureau, which did the analysis of the 46 million, and you'll find the following. First of all, out of the 46 million, 9.7 million are legal or illegal aliens. Now, I'm pro-immigration, but I do not think it is wise policy for the taxpayers in the United States to pick up the health care costs of people who are not U.S. citizens. I just don't. I don't think that's right. We have 17 million people who are uninsured today who make $50,000 or more a year. In fact, we have nearly 5 million who make more than $100,000 a year. Now look, we're a nation of personal responsibility. And I do not think it is the responsibility of the taxpayer to pick up the cost for people who can contribute or purchase their own. I wish they had insurance. If they get sick or get in an accident, I bet they wish they had insurance. But it is their responsibility, not our responsibility, to pick up the tab. They can afford even a bare bones policy. I heard some people yelling for us to bail out the rich, and I disagree with them. The rich ought to pay their own way. 14 million. We got 14 million people out of that 46 million number who are already eligible for Medicare, Medicaid, S-CHIP, Indian Health Care, TRICARE, CHAMPUS, VA, some form of government-provided health care benefit. And guess what? The government's done such a lousy job of signing them up, they aren't signed up. So the answer is, create yet another government program in order that will equally fail to sign them up? Maybe we ought to work on fixing the programs we already got in place before we go out and create a new program that will discombobulate the relationship that over 300 million Americans already have with their existing provider. Maybe we ought to work on the problem. Now take 46 minus 9.7, call it 10, because I'm in Texas and it's windy, call it 10, minus 17, minus 14, and you're left with 5. Now the number's probably larger than 5. Because of the overlap in the other groups, it might be 5, 6, or 7. And it's a big number still. And it's a number that ought to cause us to worry. Because these are the people who need our help. They make too much to get into Medicaid. They don't make enough to afford it on their own. And their employer can't afford to give it to them. But maybe we ought to focus on those people with reforms that will help make health insurance more affordable and accessible to them than it is to take the existing relationship that we've got. Look, 85% of the American people have health care coverage today. 91% think they do. I'm a little bit worried about the delta between the 85 that do and the 91 that think they have it. Honey, don't worry, we're covered. But of the 85% who have coverage, virtually all of them like their existing relationship. So why are we going to discombobulate them? Why are we going to rip it to shreds, the system we've got in place, in order to solve a problem that we're really not focused on, which are the working poor who cannot afford it and don't get Medicaid? Now, the other thing that bothers me about this is that it turns out that every single thing we've been told about this in the way of a big promise, a big selling argument, has turned out not to be true. Oh, we're doing this because we want insurance premiums to go down. Insurance premiums are likely to rise over the next decade. If we do nothing, they're likely to rise by 77%. And we got to do something to rein in the growth of those premiums. And then we find out, because of the mandates and the regulations and the new requirements, insurance premiums over the next decade under the new law are likely to rise 111%. More than if we did nothing. Oh, we were told we need to bend the health care curve down. We're spending too much as a nation. We need to have that rise in spending on health care. We need to bend the health care curve down. And now the CBO comes out, and now HHS comes out and says, guess what? We as a nation will spend more at the end of the next decade on health care than if we did nothing. Oh, we were told if you like what you got, you can keep it. But the bill has such perverse incentives in it for people to dump their coverage that now an estimated 118 million Americans are going to lose their existing coverage. As I travel around the country, I'm starting to run into people grappling with this question. I was in Johnson County, Kansas, west of Kansas City, being driven around by a guy who runs a construction company. 70 employees, had $50 million of sales in 08, made some money. Had $50 million in sales in 09 and broke even. Everybody was honing their pencils and cutting the budget and cutting the numbers and bidding to cover their overhead. He's going to have $50 million in sales this year. He thinks that he's going to lose money. I said, what's this health care bill going to do to you? He said, we put out $598,000 for my health care coverage for my employees. Got a pretty generous program. If you've been with him for 6 years, he'll give you $8,400 for a family of 4. I said, what's going to happen? He said, well, I've been talking to my human resources counselor, my outside benefits counselor, and by 2015, when this bill is enacted, I will have annual costs of $900,000 a year. And I don't know where I'm going to come up with the money. $800,000 to $900,000 a year, up from $598,000. He says, however, if I dump my coverage for my employees, I get a pass on the first 40, and I pay a $2,000 a person fine on the next 30. So rather than putting out $598,000 like I am today, or $800,000 to $900,000, I'll put out $60,000. He said, I prefer not to do it, but I think I've got to. Now, it's not just the small guy and small gal that's looking at this. I was having dinner with a guy who runs a company. You'd recognize the name of it. He's got 100,000 employees. He's in the restaurant business. I said, what's the bill going to do to you? He said, I'm putting out $25 million a year right now for our health care premiums. I got a lot of part-time workers and a lot of younger workers who elect not to participate because we require some skin in the game. He says, because of the new bill by 2015, my tab is going to be $90 million. He said, I don't have $65 million in free cash flow lying around. I said, what are you going to do? He said, I'm going to do the following. I'm going to dump insurance coverage for every single employee starting next year with the headquarters people and starting with me. We'll all have our coverage dumped. And then, because the law says that you're a full-time employee, if you have